going to do the lower extremity peripheral vascular exam. So first I'm going to start with the visual aspect of it. So I'm just going to be looking for any abnormalities all the way from the hip down to the foot, and look at it in each leg bilaterally. And then next I will do skin temperature. So I'm going to use bilateral back of my hands, feeling for any abnormality in temperature from side to side. And something's pretty funny, but then we'll move into the nail compression test. So I'm going to be compressing the big toe nails bilaterally and looking for the coloration of the nails, how they fade and how they come back. Then I will be looking for, we'll do a pitting edema test. So we'll do it on the dorsum of the foot. So you push on the dorsum of the foot, and you can do it bilaterally. And then you can also do it at the superior aspect of the shin. And you're looking for that pitting after after you release your fingers, that continuous pitting. We are looking for any abnormal thick spots in the skin. Then we will be going for pulses. So we will start with the dorsal pedis. The dorsal pedis pulse. So this pulse is going to be on the top of the foot, lateral to the extensor tendon. So find that extensor tendon, and then we are feeling for this pulse, and you can do this bilaterally. Then you will move up for the, first we'll do the posterior tibial. So we're going to go behind the medial malleolus, and you can feel this bilaterally, the pulse. Then we'll go into the popliteal pulse. So we'll have them flex the knee slightly and get in the popliteal fossa there, and feel for the popliteal pulse, and you can do that bilaterally. Then we'll move into femoral pulse. So this is me up near the femoral triangle, kind of there. So we'll be underneath the patient's shorts. And we would do this one bilaterally as well. Then we will, in that same region there, in that femoral triangle, we're feeling for those inguinal lymph nodes. And then we will, at the same time as you're feeling for those inguinal lymph nodes, you would be feeling for the femoral, the herniations, and you would feel for those herniations bilateral. Then we'll move into the femoral artery auscultation. So with my bell, I'm going to I'm going to auscultate the femoral artery. And we would do this bilaterally. Then we'll move into more of the special tests. So we'll move into Homensign, which would be roughly 45 degrees of flexion of the hip. Then we're going to dorsal, flex the foot, and then squeeze the calf. Is there any pain with that?
No.
And there's no pain with that. We do that bilaterally. Then we do leg elevation tests. So we'll elevate the legs like so, and you do this approximately for a minute, and I can have him wiggle his feet back and forth, and he would do that, and you approximately do this for 60 seconds. You will look at the skin, watching for that fade, getting pale, and then once you're 60 seconds and the skin gets pale, you would have the patient sit up as you bring the legs to the floor, and you would watch the color change in the feet and legs, see how long it takes. And then we will go to the venous tap test. So I'll have my patient lay supine again. I'll have a hand on the medial thigh, and then my other hand tapping on the so the medial thigh just below the inguinal ligaments, or at the top of the medial thigh. Then the other hand is going to be tapping on the medial knee, just medial to the knee, and you'd feel for these pulsations on your superior hand, and you do that bilaterally as well, and that will do it for the lower extremity vascular